Anarita Esparza is our Women's Health Fellow, and she's here to answer some questions for us. Common mistakes that residents have regarding cervical cancer screenings.
Thank you. So with the new guidelines, there's a lot of misinterpretation and a lot of confusion. I think I've gotten to know some of the things that confuse people the most. So the first thing is more related to the lab here and the way that they tell us when there's an abnormality. So I have a couple examples here. The first thing is that people ask H, and it's because of the way the lab reports it. So the lab says atypical squamous cells of undetermined significance, and a lot of people just stop reading right there. However, if you keep reading, it says cannot exclude a high-grade process. And so if you were to get an ASCUS, and atypical squamous cells of undetermined significance with an HPV negative, you say, stop, she's normal, repeat 3 years. However, an ASK-H needs a copal no matter what the HPV status is. So that's a mistake because people are just busy, they forget to just read the whole thing. I've also seen atypical glandular cells get missed that way because you don't read the whole text. So that's one thing. The other thing is that when the lab reports a high-grade lesion, they will say that this is representative of dysplasia, severe dysplasia being CIN2 and CIN3. So I've seen people read this and say, oh my gosh, my patient has CIN2, CIN3, I'm going to refer them to gynae, without ever stopping to think that CIN1, CIN2, and CIN3 can only be picked up on a biopsy, not on a PAP. What they're telling you is that you should correlate this and make sure that you're doing follow-up because your patient could have CIN2 or 3. So you should do a copal. That does not mean that that's what they have. It means that it's suspicious for that. So don't automatically send these people to gynae for a LEAP without doing the copal here first. The biggest error that I see with the new guidelines is that people don't look at the history, and the history is very, very important. I'll give you an example. Let's look at this slide here. When you look at a PAP, look at the history. It is so important because let's say you have an ASCUS HPV negative PAP, okay? Usually, an ASCUS HPV negative test means you should repeat co-testing in 3 years, not 5, 3, so that's important. However, if you did not look at the history and you did not realize that this patient previously has had CIN1, you would be missing something very important, which is that a patient with a history of CIN1 who has an ASCUS PAP needs another copal. So that is why I work so diligently on creating the flow sheet on Athena and updating it as much as possible. Look at the flow sheet, look at the history, and make sure that you're following the algorithm for the right diagnosis. And if you have any questions, come and find me.